hope you're having a nice day so far. My name is Pooja Kunapin. I'm from West Bloomfield, Michigan, and my project is about transforming healthcare using the Internet of Things. Chronic illness is pervasive and getting worse. It accounts for 75% of the total money spent for healthcare in the US. Our population is aging, and 70 million people are over 65 in the US currently. This only means that this problem is going to continue to worsen in the future. Chronically ill patients require constant monitoring, usually in a hospital, and these frequent hospital visits can be very expensive. So chronic disease management requires early detection and treatment, which can eventually reduce healthcare costs. So the solution is that technologies such as IoT and cloud can be used to create systems like mine that support the shift of healthcare from hospitals to your home environment. This is a diagram of my system architecture that I created. In the next slide, I'll tell you more about what my system does. So what does my system do? So that is a diagram of my system. That is how my system actually looks. That is how the text alert looks, and that is my code. So what does my system do? It monitors your heart rate using the heart rate sensor, as you can see over there where my finger is. It then displays the heart rate on the LCD, that red screen, so that you can see it. It will then transmit the data that it collects to the cloud using internet. If there's an abnormal heart rate, which means that the heart rate goes above the threshold set in the code, then my system will beep to alert the user, and it will also send a text alert to medical personnel with the URL link to the patient's data. And that's the cool part, because the doctor can then just receive the text alert and click on the URL link and immediately access the patient's data in the cloud. This can also apply to family members who are worried about their loved ones, and they can also access their data. The system can be enhanced by just adding a couple more sensors, like a blood glucose sensor or blood pressure sensor. So these are a couple of graphs. I collected my own data using my system, and the data is shown in these graphs. I figured out that if you have a lower resting heart rate in the range of 60 to 100 beats per minute, your heart rate is healthy. So the technology I used is Intel Edison technology. My heart rate sensor is what measures your heart rate. I wrote an Arduino program in my Arduino IDE, and it was written in the C language. ThinkSpeak is my IoT service provider. That's where all the data gets stored. Twilio is the cloud communication service, and this is what sends the text alert. So in conclusion, what can IoT and cloud really do for healthcare? It can develop solutions like my system that are convenient, cost efficient, and can save lives. Thank you very much.
Awesome. So up next we have